All right, and I'll hand it over to you, Zachary.
Welcome all to this February monthly gathering, our very first meeting of the year. My name is Zachary Tong, the president mentee, and I will be your host for this special monthly gathering. It is great to see you all again and kickstart the year with a special meeting presented by Lions Club of Melbourne Next Gen. COVID-19 was a struggle. Many lives were lost, but this didn't stop us from finding any opportunities to serve the community. Throughout the years, we have been serving the community in our conventional way and raised money for our project funds. This is due to all the compassionate charity work and effort from you all since day one, which is the past 4 years. During the lockdown, you could say that it was fate that we came across a man named Jason Smith from the Eastern Health Foundation, who tried to help the community by raising funds for equipment in the battle against COVID-19. Our club is very fortunate to have the ability to help. We used $5,000 from our project fund to donate to this worthy cause. I am very proud of all our club members. This project is what our club is about, which is serving the community. And we are so lucky that Jason has taken his time to show us the equipment that we helped purchase. I would like to call upon Lion Cub Carissa to give Jason a warm welcome.
Hi, I'm Clarissa, and clap, clap. I'd just like to welcome Jason today. He's a director from the Eastern Health Foundation, and today he's sharing with us the rapid testing machine, Gen Expert, that our club helped to purchase, as Zach mentioned, with $5,000, which was made at the beginning of COVID-19 pandemic last year. So I'll just talk a little bit about Jason's background. Jason was born in Canada and he moved to Australia in 2005 for a new life away from the snow. He has 2 children, one in grade 5 and one in grade 3. He loves cooking and reading and works at Eastern Health, a group of hospitals in Melbourne, including one that we're very familiar with, Box Hill Hospital. He is the director of the foundation, which raises funds from the community for new equipment and support for doctors and nurses. When Jason was younger, he studied economics and mathematics in Canada and the UK. So before I hand over to Jason, I'd just like to do a bit of housekeeping. So for the presentation, if you have any questions or comments, please put them in the chat, and then I'm sure Jason will help answer them at the end of the presentation. So let's welcome Jason.
Thank you so much, Clarissa and Zachary. That's such a nice, warm introduction, and well done to you both. And thank you for having me today. I would like to say a particular thank you to President Sam, Hilda, Sandra, Lawrence, for your very warm welcome and giving me the opportunity to be here today. It's really, really great. Now, I will be running a little slideshow for you today. So let me just try to work out the technology here. Just bear with me 1 second. Okay, can you all see this? Yeah? Okay, that's great. Now, please feel free to ask any questions throughout. It's completely fine. And if you want to use the chat function as well, please do so, okay? And I'll monitor it and I'll try to answer any questions that you may have. Okay, now, before we start, a little quiz for you. Do you recognize this hospital? Any of you? Does it look familiar? I'm seeing some smiles. I'm seeing some, yeah, some thumbs up. Does anybody know which hospital it is? You can tell me, you can unmute yourself if you want.
Box Hill Hospital.
Yeah, that's right. Well done. That's, what is your name? Sorry.
That was Lucas.
Lucas. Well done, Lucas. That's exactly right. It's Box Hill Hospital. And I know that many of you have been to Box Hill Hospital. And it's one of 7 hospitals in the eastern region of Melbourne that is run by Eastern Health. And I'll tell you a little bit all about this in a moment. But what I really want to do today is to thank you, all of you in the room, and everybody else who have been part of the fundraising effort to raise money for this machine. This is just amazing what you've done, and it's good for everybody. It's good for the patients of the hospital. It's good for their families and their friends. And it's good for all of us as well, because when we do good things and support places that we love, it makes us feel good as well. So I really, really want to thank you. And what I would also like to do today is to tell you a little bit about some things for the future that we would like to do again with community support. But before I do that, let me tell you a little bit about myself, and Clarissa and Zachary have already shared with you a few things about my life. And as they said, I have two children, one in grade 3, Anik, on the left-hand side, and one in grade 5, Luca, on the right-hand side. Now, this is an old picture, so they're much bigger now, much, much bigger, and they're much naughtier as well. But that's okay. We love them all the same. And Anik is a great fan of the Babysitters Club, and Luca loves Minecraft. Do any of you here familiar with those two? Well, they're not games really, yeah, I can see some nods. Yeah, definitely. I'm even wearing a Minecraft t-shirt here today. I'm not sure if you can see. There you go. Now, Luca and Anik, and all of you in the room here today, are very, very lucky kids. Do you know why? You're very, very lucky kids because we live in a country where no matter how rich or poor you are, you get access to first-class healthcare anytime you want. Yeah, and these are just a few examples to help you understand that. So on the top left-hand corner there, let's just assume that you have, I don't know, you have a bit of fever and it's pretty severe and you have to stay in hospital overnight. Well, this will cost anywhere between $1,300 to $4,000 a night to have you in hospital. Okay. Now, let's say things are a little bit more serious. Let's say somebody in your family is very, very sick and needs a lot of care, needs a full-time nurse all the time to be with them. That's the picture on the top right-hand corner there. So that will cost about $4,000 a day to be able to do this, to be able to look after somebody who's very, very sick, who needs a respirator, for example. And now let's say you have a mother who's giving birth in hospital, and that can be anywhere from $9,000 to be able to do that. But that's okay, because we live in a country where the government is saying, it's okay, you don't have to pay this. You can just come to hospital and we will look after you. And we're very, very lucky to have this because it's not every country in the world that has this system. We're very lucky as well to be living here because Australia has a very good track record at dealing with health emergencies. And I think we're all familiar with this latest one. It's all changed our lives. And we have seen the response. And there have been some standout countries across the world, Australia, China, Taiwan, a few others as well that have done really, really well at doing this. And Australia has a little bit of history of that. I'm not sure if anybody knows about the HIV Aids epidemic in the 1980s. You were not born at the time, so that's okay if you don't know about it. But it was a similar situation. There was a big, nasty virus that everybody got really afraid of, and countries reacted very differently to this. And Australia did really, really well at controlling the virus and making sure that people don't catch it. Now, this is all good and fine, but sometimes what the government gives the hospital to do their good work is not enough. So sometimes there is a gap between what the government gives and what the hospital needs to pay to deliver the services. So let me just give you one example, all right? So let's say your parent is really, really nice and says to you, for Christmas, I am going to give you $1,000 to get a new iPhone. You think, wow, that's pretty amazing. That's a pretty good gift. But the $1,000 will enable you to maybe buy an iPhone 11, but you want the latest one. You want the iPhone 12 because it's got all these new widgets and special camera and the 5G and all of that. But the iPhone 12 is $1,500. You see, there's a gap. There's not enough. So you need to work and find ways of getting the rest of the money to be able to get the iPhone 12 that you really want. Well, in hospitals, it's the same. We're not getting iPhones, of course, but what we're getting that is not necessarily supported by the government are things like research, for example, medical research, or they can be things like scholarships for our nurses as well, for them to do postgraduate education, or it can be equipment as well, because equipment is really, really expensive. And I'll tell you a little bit more about this in a moment. And very often it is so expensive that the government support that we get is not enough. We need a little bit more. And that's what we do at Eastern Health Foundation. So I work with a small team of people, and the work that we do is to connect with good organizations like yours to try to find that money. Now, let me tell you a little bit about Eastern Health. Does anybody recognize this map? Anyone? Yeah, Zachary, do you want to have a go?
It looks like the map of Australia, like Melbourne.
Yeah, that's right. It is the map. It's a part of Australia. Do you know which part?
Victoria.
Yeah, I heard Victoria. That's right. I think there was a couple of you. It's the south. Yeah, the south of Australia in our state of Victoria. So you can see the state of Victoria is broken down in 6 regions when it comes to hospitals. And each of these regions have a number of public hospitals. So Eastern Health is the region that is in yellow on this map. So in this tiny little region there, there's 800,000 people who live there. It's very, very populated. And we have 7 hospitals in this region and 1 service that looks after the whole of Victoria as well. And this is what they are. You can see them all here. So you have Box Hill Hospital, but you have a few others as well. Now, do you know, this is a little quiz here, do you know which hospital you raised funds for? Where is the machine that you raised funds for? Yeah, Zachary, again?
Is it Box Hill Hospital?
It's not Box Hill, but you're not far. If you look at the list, you're not far. I'm trying to look at all the faces now. Does anybody want to have a go? A guess? Yeah, Zachary?
Angus Hospital.
Yeah, that's exactly right. It's Angus Hospital. That's right. So Angus Hospital is a very, very old hospital. So it's in the eastern part of Melbourne, and it was founded in 1939. So just at the beginning of the Second World War. So it's 82 years old. And at the time, you can see here on the left-hand side, it was a tiny, tiny little hospital. It had 2 surgical theaters. And in those days, it was very, very basic the way that hospitals were run. So there was a surgical theater at that hospital to do some complex operations. And to sterilize the instruments, they were using big pots of boiling water where the instruments would go in to sterilize in between each operation. So very, very basic. So when you look and hear that and compare that to the picture on the right-hand side, which is what the hospital has become now, you can see it's very, very different now. State-of-the-art hospital with brand new beds and equipment and all of that. It's amazing. Now, this hospital is pretty special because there's a very, very long history of clubs like yours that have supported the hospital. And I'll tell you something very funny here, because in the olden days, the way that people were raising money was very different to today, right? Very, very different. So this hospital needed a children's ward many, many, many years ago, a long time ago. Do you know what they did to raise money for the children's ward, the community? They did some chook raffles run. So they were getting chooks and they got them to do some races. And there was some raffles. People were betting for the chook that would be the fastest. And that's how they raised in those days, it was 10,000 shillings. We were not even using Australian dollars. We were using shillings. That's how old it was. So they raised 10,000 shillings to bring to build a new children's ward. Now that's all good and fine. We have this brand new hospital now, which has nothing to do with this whole hospital that you can see, brand new. But COVID brought a big, big, big problem. Big problem. Now, let me tell you about this problem. There have been many problems with COVID, but this was the problem at this hospital. So let's just assume that you have a bit of a tummy ache and you need to go to the emergency department at the hospital so that the doctor and the nurse can look at your tummy. Now, in normal circumstances, what would happen would be that you would be admitted to the emergency department and you would maybe stay there for 1 or 2 hours. And then if you're really sick, you would be moved to a bed in the hospital. That's normally how things happen. But because of COVID, we cannot do this anymore. Because let's just assume that you have a tummy ache. But as well as having a tummy ache, you have a runny nose, you're coughing, you have a bit of fever. So in other words, you might have the virus. So that's a problem because we cannot do anything with you. We have to keep you in the emergency department until you have a COVID test and until the test is negative. So you need to stay in a room on your own. It's an isolation room in the emergency department. And you have to wait. And it takes a very, very long time because your test needs to go to Boxer Hospital. It needs to be tested in the lab there at Boxer Hospital. And that takes a long time. So people have to wait 4 hours, 5 hours, sometimes even more than that in this little room before they move on to a bed. So that's not a very good thing, right? Because you just want to be quickly in and out of hospital. You don't want to stay if you don't want to stay. It's not the most pleasant environment. Now, we had a solution to this problem, and you know about it. It's this little machine, and it's called the Gene Expert machine, and I'll tell you all about it and how it works. But in a nutshell, this machine reduces the time that it takes to get a test result to 57 minutes. So just 57 minutes, that's really, really quick. So that means that you can just stay not even an hour in the emergency department, and then you can go to the bed if you need to. And that's really good. But then we had another problem. You want to guess what it was? Try to think about the iPhone analogy that I used earlier. Yeah, Zachary, you're raising your hand.
They didn't have enough money to get it.
Yeah, that's exactly right. That's exactly right. And that's because this machine costs a lot of money, a lot of money. So we had to do something about it. And we were very, very lucky because this club and dozens of other people in the community got together to help us raise this amount of money. And that's really, really good because now we have the machine and it works. And do you know how many tests this machine is doing every month at the moment? You want to have a guess? Just give me a number, anyone. The number of COVID tests that this machine is doing every month to patients. Yeah, just unmute yourself if you want to talk, that's fine.
Dylan, then you raise your hand.
Around 25.
It's a little bit more than that. It's got 3 digits. Yeah, go for it. Yeah, Marcus, yeah.
750.
That's pretty close. It's 500. 500 tests a month at the moment that this little machine is doing. Now I'm going to show you a little video and explain how it all works. Now, just bear with me. I'm going to have to exit the slideshow and I'm going to have to share the video, and I can see there's a question in the chat as well. So I'll get to that. All right. Won't be too long. Okay. Can you see my screen now?
Yep.
Yeah. My apologies. Something's not right here. I can't see my little video.
Jason, do you want me to see if I can play the video on
Yeah, yeah, sure. Thank you.
No worries, just hang on one tick. Just bear with me for one tick. Is this the one? Can you see it?
Yes, that's the one. That's the one.
It's on loop at the moment. If you want to talk through it, would you like to talk?
Yeah. So you see, it's a very small machine. It doesn't take a lot of space. That's really good because there's a lot of things in a hospital. We don't want big machines. And you see, it's a little cartridge. So in that little cartridge, there is the COVID test, and that goes in the machine. And then with the computer, we get a result in 57 minutes. That's pretty cool, right? Now, let me tell you how this works. What's the science behind this? And I might just need to, if that's okay, I might just try to share my slideshow again. Oh, thank you. Okay. Now let's go back to a little COVID virus. Where is it? Okay, so you've seen this image before, haven't you? You know what a COVID virus looks like. So a COVID virus has these little spikes, and these are spike proteins. And in order to make these proteins, you need a molecule called the RNA. It's very similar to the DNA, but it's called RNA, and that's essential to be able to build those little spikes, right? So what this machine does is that it picks up on this RNA, on tiny, tiny levels of RNA that you might have, and then it multiplies it and it amplifies it. And it does that with some special enzymes and chemistry. So even if you have a little bit of it, what the machine will do is it will multiply and amplify it. And it's a very smart machine because not only can it work on COVID, but it also works on influenza as well. Yeah, so at the moment we have very, very low numbers of influenza across Australia because people are social distancing and they're washing their hands and all of that, but this might change. So when it does change, and when we have people who need a quick influenza test, we'll be able to use that very same machine. So this is a really good investment because it can work on multiple viruses, not just one virus. Now let me go back to the slideshow. So there we go. That's the fruit of your labor. That's what you've done. And again, I just want to thank you very, very much. And I want to thank you on behalf of the 500 patients every month who now have access to this test, and they don't have to wait at the emergency department and get worried for too long. And so just imagine each of these 500 people, there might be children, there might be grandparents, and they have friends and families. And so it's the impact that you've had is far greater than 500 people. It's many, many more, all the families and friends of these people as well. Go ahead, Sam. You have a question.
Yeah, actually, I've got quite a few, actually. Sorry, I might let some of the others go first. Is there any of the kids that want to ask something before I do?
Anyone, just unmute yourself. That's fine.
Kids?
Anyone? Does anyone have a question, or else I'm going to bombard away?
Well, Avery had one, but Bonnie answered it for Jason.
Okay. Okay, then I'll start. Jason, I was wondering with the cartridge. So it looked like some sort of liquid that was in the cartridge that was used as a basis for the test. So is it just another swab? Is that how you do it?
Yes,
put it in.
That's right.
I presume, is it?
Yes, so it's the swab. So it's the mucus and the saliva and all of those wonderful things.
Mm-hmm. And the container was pretty big. So what was actually in there as well? So you do the swab, and then was there some sort of liquid or something like that in there as well?
Yes. We need the solution in there because we need the enzymes to amplify the RNA. Mm-hmm. There's a special liquid that goes in there as well to be able to do that.
Okay, I see. Mm-hmm. And say with the, you were talking about, say, so the machine predominantly is used for all the patients that are actually going to the emergency to give them a quick test to see if you whether need to isolate them or if they can actually wait in the general public room. Is that how it works for the gene expert, the equipment that you're using at the Anglis Hospital?
Yeah. So it's for patients that show symptoms. So if you have symptoms and you've been admitted to the emergency department, then we can give you this test so that you don't have to wait there for too long. If you don't have symptoms, then that's okay. You won't receive the test. Mm. But if you have symptoms, we now have access to this machine.
I see. How long is there a lot of training required to do the use the equipment, or
there was a little bit of training, but it's a pretty simple machine to use. Mm-hmm. So the main risk with this is really around infection control, right? Because you don't want to, as you put the swab in the cartridge, you want to make sure that there's nothing that goes on you, or so that's the main thing, just making sure that everybody stays safe. Mm-hmm. And that you have all the protective equipment that you need when you do that procedure.
Well, what's the accuracy of the test? Do you have to run a couple of tests? And I saw there were actually two components to it. So Is it you can run 2 tests concurrently, or is it do you want to do 2 swabs and put it in? Is that how it works?
Yeah, you can do 2 at the same time, and it's a very, very accurate test. So it's what we call a PCR test. So there's 2 types of COVID tests. You have the PCR test, and then you have the antibody test. So the PCR test measures the genetic material of the virus, whereas the antibody test measures the immune response when people get infected. And the PCR is far better. It's a far more effective and reliable test. And this is what this machine is. It's a PCR COVID test.
All right, Sandra has a question. Do you want to ask away or?
Go ahead, Sandra.
Just wondering if, if the patient shows symptoms of COVID, and then you swab the test, do they don't wait in the general waiting area, or do they actually move into a separate room to wait for the results?
Yes, so it's an isolation room in the emergency department, and it's got negative air pressure in there. So that means that the air just stays in. Even if you open the door, the air is not going to flow out. And so they have to wait there. And as you can imagine, it's not very pleasant to be in a little room on your own. So, and yes, you get a doctor and a nurse to come and visit you, but you're isolated. So it's not fun.
Yeah. What happens if you have multiple patients that are showing symptoms?
Well, if we have multiple patients, the beauty of this test now is that we can go pretty quickly. People can come in and out of the isolation room pretty quickly. So, whereas in the previous times, that would have been a problem, yes.
All right, Avery has another question. Avery, do you want to ask the question or?
Yeah. Do you know how many hospitals have that machine?
That's a really good question, Avery. I don't know, but I can find out for you. That's a really good one. I suspect quite a few.
The chances are we can raise money again, right? For another machine.
Right. That's right.
Okay.
Yeah, there must be quite a few. It's even used in parts of the world that tuberculosis, which is a disease that we don't really see here in Australia, thankfully, but it's a pretty nasty disease in other parts of the world, and that machine can even be used for that, to get a rapid tuberculosis test. It's pretty smart.
All right, Lucas, do you have a question as well?
Where was the machine originally made?
I think that's a very good question, Lucas. I think it's an American machine, but again, I'll double check that for you.
All right, Clarissa?
This is not so much to do with the actual machine itself, but what testing method do other hospitals use if they don't have the machine?
So the main method, Clarissa, is the PCR test. So the vast majority of hospitals will use a PCR test in their lab to be able to test for the virus. And as you know, that test is pretty good. It's pretty reliable. And the results are coming much faster now as well. But it's not as fast as this machine, unfortunately. So yes, a PCR test. If you Google that, you're going to see there's a lot of information on the PCR test and the difference between a PCR test and an antibody test. They're very different techniques that are used to test for COVID.
I've got one. My wife's going to love this. Okay, so you said it can be used for different influences, right? So do you actually use it for different influences? If so, how do you clean it afterwards every single time? Like, how do you, you know, clean it up and just to make sure it's not going to contaminate other samples, other swabs, and other things like that.
Yeah, that's a really good question, Lawrence. We haven't used it for influenza because there's no influenza at the moment. It's magical. We have never seen this before. Now the cartridge, it's a single-use cartridge. So you use it once, then you have to dispose of it. You can't reuse it, unfortunately.
All right.
Yeah,
Mr. Sam.
So if it's single-use technology is relatively, so I guess is there a lot of ongoing cost to it? Because like say with GMP facilities, also with single-use technologies, those items are fairly expensive.
Yes, they are expensive, but that's all covered by the government. And that's the problem with government funding. Government funding is very good at funding activity, right?
Okay. Mm-hmm.
But what government funding is not so good at doing is the initial capital outlay. That's where the problem is. And that's where community support is so important, to get the equipment. And once we have the equipment, then we can run the equipment and we get some support to be able to do that.
Miss Bonnie?
If it is like single-use technology alongside being contaminated waste, how does that work with properly disposing of? I know that our club does a lot with looking after recycling and stuff like that, but we haven't really looked into medical waste because it is contaminated. So how does it work with like disposing of that once it's been used?
That's a really good question, Bonnie, and I don't have the answer. I'm so sorry, but I can find out, because yes, certainly there would be some protocols in place, no doubt, because it's environmental waste, it's biomedical waste as well. So you can't just put it.
Actually, I might be able to ask a bit further, because normally with contaminated waste, you can actually put it into autoclaves, and then that'll actually sterilize it, and then you'd be able to dispose of it as normal general waste.
That's right.
Since it looks like plastic, you might be able to actually even recycle that. But otherwise, so there's another option, is that a lot of people, they actually use third parties to actually dispose of contaminated waste. So they'll be able to autoclave it or sterilize it before and then put it down away. So it really depends on how the hospital have got that organized. So I guess if you don't have an autoclave to do it yourself, then you probably have to find another party to actually do it then.
Yeah, that's right. I will find out. That's a really good question.
Jason,
Dylan, did you have your hand up?
Sorry.
Or were you just exercising?
No.
Okay. Jason, can I ask with the isolation room? So if someone tests positive and someone's in that negative pressured room, then I presume that there's going to be a whole bit of cleanup, and then there's like a cleanup crew or something like that. Is that what happens? And then
yes, there's a lot of cleanup involved, and then this patient gets moved to a dedicated COVID ward. So this patient cannot just go to any ward. I don't believe we have a COVID ward at the Angliss Hospital anymore, but there is certainly one at Box Hill. So most likely this patient will have to go to a COVID ward at Box Hill Hospital with all the infection controls in place.
Have you had that situation happen or heard of it happen in the Angliss?
Not in recent times, because we haven't had any positive cases now for a little while. I suspect, so this machine is not very old, so I suspect not. Because since we've had the machine, we've been fortunate enough to have either no cases or very low number of cases across Victoria. And let's hope it stays that way.
And Jason, lastly, you did mention PPE involved in handling the equipment. Would you be able to run everyone through the PPE, the protective equipment?
Okay, so a special mask, of course, not a surgical mask, but a special fitted mask. Eye shield as well, and the full plastic the full plastic attire. So it's a little bit like a person going on Mars.
So it's a whole full-on body suit.
It's the full body. That's right. That's right. And gloves as well, of course.
Actually, that's an interesting one. Sorry, so many flow-on questions. So it takes a while to gown up in the spacesuits and you know, all that. So how much time is the users allowed in terms of the shift? Because obviously that'll impact on another ongoing cost, which is your PPE costs as well, isn't it? And I presume that'll be disposed of or autoclassed
yes.
out, you know, once done, isn't it?
Oh yes, yes, that will be disposed of as well. The ships, that's a good question, Sam. I wouldn't know. I guess that will depend. Each area of the hospital will have different ships. Again, I could get back to you on this one, but yes, the PPE, unfortunately, that's once again more waste, unfortunately. This COVID virus has generated a lot of waste. That's been another nasty side effect of this little bug. A lot of plastic and masks, and it's very unfortunate.
Sandra, you had a question?
Yeah, I was just wondering if the patient tested positive, how do they get transported to the COVID ward? Like, do you sort of wrap them up and then just send them off?
That's a good question. I had that one as well.
So most likely it would be a dedicated vehicle, Sandra. And again, I could find out the details of that, but it wouldn't just be your typical ambulance. Most likely it would be a dedicated vehicle that deals with those issues. And most likely the patient would have to be, yes, covered up in some way.
Cybertruck.
That's right. As we know, that the transport is the weakest link, isn't it? Well, one of the weakest links anyway. That's where the virus loves to have a party and spread around. Have to be very careful.
Sorry, just wanted to ask, not related to the machine, more related to COVID. Now that there's like the European strand here, what's the difference between the European strand and the one that we're normally dealing with here, other than it's more contagious?
Yes, well, the European strand is a mutant form of the virus, and that is completely normal. That's what viruses do. They find new ways to look a little bit different, and we know that that's what the influenza virus has done as well. And so this mutant strain, are you still there, by the way?
Yes, we're still here.
Okay, yep. I'm sorry. I've just, my screen is looking a bit different. My apologies. So there are two strains at the moment that are of concern. There is you may have heard of the UK strain, and you may have heard of the South African strain as well. And there's a lot of research being done on those two strains at the moment because it is thought that they are far more contagious. And it is also thought that they might be more deadly as well, although the research is still to be fully reveal the extent of those two things. So that's why we had a lockdown. You may remember, I think it's all very fresh in our mind, just a few days ago, because there was concern that this mutant strain was out there in the community. And those two strains have names as well. What they have I think they start with the letter R and then they have a number.
So the two strain molecules actually look slightly different?
Yeah, that's a good question. I don't know if it looks different or if it's just the behavior of the virus that is different. I suspect it's a fairly, and again, I could confirm that for you. I suspect it's a fairly similar looking virus with the spikes. I don't think that will be different. But it's just the way that it interacts with the human body that is slightly different.
Lucas, you had a question as well?
Yeah. How long can the machine run for until it needs to be replaced? And how accurate is it?
Yeah, so it's this machine will last probably in excess of 5 years, Lucas. Medical technology these days, you're looking at anything between 5 to 15 years for a piece of equipment. That's fairly standard. And this test is very reliable. So we're looking at, and again, I can confirm that for you. I think we're looking at 99% plus accuracy. It's a very accurate test.
Anyone else? Any
Does
questions?
the machine need regular maintenance? So would you need to set up like a contractor to regularly maintain and sort of oil the things, make sure it's actually running correctly?
Yeah, so it's in these days it's not so much the mechanic, it's more the software, right? So that's the main maintenance part, to be able to upgrade the software when required, because this machine constantly, the technology constantly evolves, and there are new softwares that we can use, or new versions of the software. And that's really where the maintenance part is. And there's a company, the company that is helping us to do this is called CEPHEID, CEPHEID, I believe. So we do have an arrangement with them to be able to do those things for us. Can you still see my slideshow? I'm very sorry, I've lost.
Yes, we can still
we can still see the slideshow.
Yeah. That's great. That's great. Can I tell you a little bit about an idea for the future?
Yes, please, Jason.
Please.
Wonderful. Now I'm going to show you two images. This one and this one. Now let's just assume that, again, we'll use the same analogy as before. You're a child and you have a fever, or your tummy hurts, or whatever it is, and you have to be in a hospital. So which of these two environments would you prefer to be in? Would you prefer to be in this first one here with the white walls and, there's a bit of color, but not much? Or would you prefer to be in a place like this? Now, just unmute yourself. That's fine.
Zach?
I'd prefer to be in the second one because it's because it brightens your day, but the other one, all you get to do is play with blocks. And there's only a little bit of color. That's kind of not that fun to go in.
Yeah, that's exactly right. And that's what we feel as well. This is at Box Hill Hospital, that first picture. This is what the children's ward looks like at the moment at Box Hill Hospital. It's pretty boring, isn't it? And we think that we could do so much better to make this place a little bit more welcoming. And we have actually sought the advice of a group of artists that could help us do that. And this is some concepts that they have sent to us. And what they're looking at doing would be to have pictures of Australian animals on the walls and some nice bright colors. And it's a group of 4 artists. Their names are Libby, Emma, Juliet, and Tess. And so we've been working with them and making those plans. But once again, it's the same problem that I've explained before. So this is a little project that we're seeking to get across the line to make the children's ward just a little more welcoming and nicer for our patients. And
Jason,
that's all.
Sorry, Jason, can I ask you a bit further? Can you go back to that image, please? Can I ask you, how much are you looking at, say, how do I put it? Say to decorate one room, how much fees would you need? How much funds would you need? per room
So
based on safety?
I could send you some more information, Sam. The artists have told us that to do the work that they're seeking to do, which would be not only a few rooms, but the general ward as well, it would be in the order of about $25,000. And the reason why this is so expensive is that you cannot paint a hospital like you paint a house, right? There's all these protocols that you have to follow and make sure that you get the right paint, that it's not toxic, and that it complies with all the regulations, because we want our hospitals to be really, really safe. And so there's a lot of protocols that have to be followed. And so that's why these things, they may sound expensive when you compare to just painting a house, but yeah, those are the reasons.
And with this artwork project that you're looking at for the Box Hill Hospital, are you going to do something, I guess, similar to the equipment? You're going to wait until you total $25,000 and then do that in one hit? Or because the reason why I was asking is how much donation would you seek to do it per room? And then maybe that might be able to chunk it down, and then we'd be able to have a look and like, exactly, this is talking about how we'd be able to help. So if we can actually reduce that cost to see if we'd be able to help you out in terms of, say, a room, if you know what I mean. Is that something that
yeah, absolutely,
as well?
Absolutely. We could get a number of groups together. And the problem that we've had, and you probably have witnessed this problem yourself, is that groups, it's been a very difficult time for them. So the groups that we used to be able to go to, a lot of them now are having difficulty, and they need a bit of time to be able to raise the money. But absolutely, this could be a group effort for sure.
Yep, but definitely, this is something that we would love to have a chat to our Cubs and our club members about, to see how we can actually help. So yeah, Jason, if you don't mind, send us a bit more information in terms of a bit of detail on it, and we'd be able to have a chat to our members and see what we can do.
Yeah, wonderful. That's great. Thank you so much.
Bonnie, your hand was up.
Yeah, I was just going to say those rooms look very much like the Royal Children's Hospital. I spent a bit of time there when I was young, and was so much better being in like the fairy room or the pirate room than it ever was being in like a flat ward. So it's a really cool idea, and I can say first-hand experience, it definitely makes a difference when you're in a room that has color compared to a room that's a white wall. So I'd love to get behind it if we can.
Yeah, definitely. Oh, thanks for the feedback, Bonnie. Box Hill Hospital is still a very new hospital, and it was the new section was built in 2014, and it's got everything that we need to do the care, the complex care. But now it's all about the little extras. How do we make it even more beautiful?
I think. Paula, do you have your hands up? Have you raised your hands up? Or Marcus wants to ask a question?
I was just going to ask, so these artists are going to physically stand there and paint the walls. Is that what the plan is? Because has digital printing been considered? So like stickers on the wall rather than physically standing there to paint?
Yeah, that's a really good question, Paula. I do believe they actually sent us some information, and I think they explained their method. I believe it is not necessarily paint, but decals. Yeah.
Decals. Okay.
But I can. Let me clarify that. I believe that's in their proposal. I can share that with you.
Yeah, because
on Lawrence's
That's a good reason.
He knows why I'm asking.
I know why you're asking. Yes. I was going to ask the same.
Just because my hubby has a business in digital printing, so he does.
Oh, right.
Large scale artwork, I guess.
Yeah, there you go. Okay.
Wondering if that would be something that would be applicable in this.
Yeah, definitely. Well, let me find out. Yeah, I do have an inkling that they were decals as opposed to physical paint. Yeah.
Because actually that does make a lot of sense, because like say I design laboratories, And if you ask me, like say, if you put a decal of a vinyl or something like that, that would actually hold up much better against cleaning agents,
Yes.
and would actually be much better in a hospital or lab environment. So that may be a better way to go. And I was like Lawrence, I was suspecting, but I didn't want to say anything about what Paula wanted to say. But yeah, that would be a better solution personally. And then if you have the artwork and then print that out, yeah, that'll actually for long-term effect of your hospital and maintenance, that actually is a much better solution.
Absolutely.
Although I must say those green leaves outside ED, they're falling off.
Paula, I missed that. I'm sorry.
I was going to say, but I must say the green leaves outside ED in the corridor, they're starting to fall off.
Ah, they are too. Yes.
So we must.
They're getting a bit, yeah, old.
Look at what sort of adhesive is used as well.
Yes, yes, that's right. Well, yes, this was 7 years ago now, so 7 years old. Unfortunately, things don't last forever.
Thanks very much, Jason. Is there any other questions? Do we have any other questions for Jason? All right, sound good. If that's the case, Clarissa, should I leave it to you or to Zach? Okay, to you. Okay, then I'll hand it over to you, Clarissa.
Okay, so on behalf of the club, we just like to thank you for taking time today to speak to us about the machine and all the different hospitals and how COVID has affected all of them. Yeah, so thank you for taking time away on a Sunday afternoon. I'm sure we all learned something. It was very educational, and I'm sure the younger cubs are now a lot more experienced in terms of what has been going on. If in the future, as we mentioned with the wall painting for the or the wall art for the children's hospital, we'd love to help. Please feel free to let us know. And thank you. Let's all give Jason a big round of applause.
Thank you so much, Clarissa, and thanks everyone. It's such a pleasure to be here, and we're so proud of you all. You are the future, and there's a lot of big problems in the world, but it gives us a lot of hope when we see bright young minds like you who are doing what you're doing. So well done, and thanks again for having me in your meeting.
Thank you, Jason, for giving us a tour on the COVID-19 testing machine. It is very rare that organizations show us what we helped to purchase. It is also great to have learned something new too. Although we are not doctors, nurses, or medical workers, we should all be proud of ourselves since we have contributed and helped many people in our community with the purchase of the COVID testing machine. Now, may you all give Jason another round of applause. Thanks again, Jason. Hopefully, when things get back to normal, you have the time, we can meet you personally. Thanks again, and bye.
Merci.
Thank you so much. Merci. Thanks, everyone. Enjoy the rest of your meeting, and I hope to see you again soon.
Thank you, Jason.
Thank you, Jason.
Okay.
Thank you.
Bye.
Thank you, Jason.
Bye.
See you all.
Bye.
Bye.